Leading cause of death of Australians. Every day, 244 new people are diagnosed with dementia, joining the 400,000 who are already living with the condition.
By 2050, it's expected 135 million people around the world will have dementia, with a new case being diagnosed every 6 minutes. So, how can we protect ourselves from the devastation that is dementia?
Dr. Helena has been looking after her father, who has dementia, for the last 7 years. She joins us as a doctor and as a daughter to explain the most effective preventative measures. Lovely to have you with us. Thank you.
Thank you.
Now, a new study from the University of Edinburgh has found a really surprising way to, I guess, boost brain function. And it's cheeky.
It is. It was better than puzzles, crosswords, Sudoku, learning to draw live nude models. And it's not as bizarre as it sounds. It's because it incorporates the 3 key ways to prevent dementia. Number 1, learning a new skill, an art, a craft, a musical instrument. Secondly, social stimulation. And this was a group activity, and people were chatting about it and laughing and giggling and being cheeky about it. And the third thing that surprised the researchers was there was a lot of physical exercise. People were standing up, walking around, trying to find a different angle. So it was all these 3 things. So lots of different parts of the brain were being activated. And the more different ways you use your brain, the more effective, even the larger it becomes. And even just learning a second language later in life delays the onset of dementia by 4.5 years.
Wow. And this one thing might give you an extra 7 years to your life. It's not healthy blood pressure or not smoking. What is it?
No, it was having a positive attitude towards ageing. And that means people who continue to set meaningful goals, who wanted to achieve pleasurable things till their last breath, and focused on the good things about ageing, like getting wise, having more free time to do things they love. That alone, independent of other factors, extended your life by 7.5 years, which is great news because you don't have to worry about those whinges in your life. They'll be dead long before you.
And what about volunteering? It was shown to be very positive, wasn't it?
Yes, they studied older African American women who had risk factors for dementia like heart disease, type 2 diabetes and having had a stroke. Those are 3 big risk factors. And they gave them the opportunity to do volunteer work at a local primary school, even just 2 hours a week. And they found when they scanned their brains, there were blood flow changes in their frontal lobes, which started to reverse some of the changes in ageing brain, and their memory and mental skills improved.
That's amazing. You can actually reverse it. It's not even just like slowing it down.
Yes.
You're actually reversing it. You're getting the years back.
Helping people. Beautiful thing.
And eating well, purple and green veggies can have an impact?
Yes, purple vegetables have an antioxidant called anthocyanin, and it's anti-inflammatory, and when they've given it to both older people and children, it seemed to improve their brain function. And your greens, obviously, loads of vitamins, and your deep sea fish with their omega-3 fatty acids. So how about a sardine or salmon and spinach sandwich for lunch?
Nice.
Sounds good. Well, no, it doesn't. It was good to put on the sandwich. The sandwich is
But your purple vegetables, like your purple sweet potato, your beetroot, eggplant, blueberries, which are actually
Rhubarb.
purple. Yes. All good, really good brain foods.
Good stuff.
What are some of the early signs of dementia that we should be looking out for?
One of the most common things is you start to find you're forgetting how to do things you could do really easily before, or you're driving somewhere that you've been dozens of times and suddenly you can't remember how to get there. It's also getting confused or disoriented easily, starting to lose your motivation to do anything. Becoming socially withdrawn. Now, it sometimes looks like depression, so it's really important to differentiate between the 2. And, of course, your memory loss.
What about when people repeat the same story over and over again? Is that a sign of dementia?
It could be. It could be. It's certainly something that would set off alarm bells, and I'd say go and start to have a few tests. But diagnosis isn't instant. It's a process of observation.
Helena, there's a new trial underway in Melbourne, which is a world first.
Yes.
Very exciting news. What's happening with it?
Okay, they're going to trial a new drug called sodium selenate. Don't try this at home. Selenium is found in Brazil nuts, but it doesn't mean hoe through packets of Brazil nuts. 3 to 5 Brazil nuts is plenty, otherwise it gets toxic. And they're going to use it on patients with frontotemporal dementia. This is one that there's been no treatment to date, and it's a really difficult one because it strikes early, between 45 and 65 years. 11,500 Australians have it. And the sad thing is, Memory's the last thing to go. You start to notice personality changes, loss of language, you can't communicate and you know what's happening. So it would be fabulous. They're going to trial people for a 12-month period and see if this tablet could do something.
Yeah,
Fingers crossed it works.
Yeah,
Terrific.
indeed.
Helena, thank you.
Thank you.
Very much.